Good evening, friends. Welcome to the Fireside Chat. This is the second Fireside Chat of this series. My name is Ayush. I'm one of the founding members of this community called Growth Folks. A little bit about Growth Folks. Growth Folks is basically India's largest community of growth enthusiasts and marketeers. You can check out or join our community on Facebook, which is by the name Growth Folks itself. Little bit about this whole initiative that we are trying to do here. So basically, the idea of having this Growth Rap 2020 series is to invite industry leaders on a one-on-one fireside chat so that we can talk to them about industry trends, how the industry has coped up with COVID-19 phase, how are the what's the future holds for us in the particular industry, and many more details about that particular industry. As you all know, today we are going to talk about health tech, and this is going to be a health tech special. And for that, I have with me Dr. Manoj Gurg. Uh, to talk about Manoj a little bit, so he's the co-founder of myupchar.com, the country's biggest online resource for health information in multiple Indian languages. Dr. Garg has a PhD in economics from Stanford University. He has previously worked at the Boston Consulting Group in San Francisco. While there, he focused on healthcare delivery in India for Bill and Melinda Gates Foundation. Dr. Garg remains passionate about the potential of content and technology to deliver healthcare in every part of India. Welcome on the show, Manoj. How do you
My
feel about it?
pleasure. Thank you for having me here.
All right. So, without wasting further time, I would like to straight away ask you this very basic question. What is health tech?
So there's fintech, there is edtech, similarly there's health tech. So it's um, essentially a bunch of startups trying to fill the huge gap in healthcare using technology. So how, if you ask yourself the question, how do we use technology to bridge the divide in healthcare in India? The answer is whatever the companies that are doing, those are all health tech companies.
Got it. Just before we go ahead and to the next question, I'll try to share my screen and talk about a few trends that we have got to know about. So India's health tech market is poised to become a 21 billion opportunity by 2025. And we have the data in front of us, and this is latest by July 20, and we can see how the current year in terms of market size, but at the same time, how aggressively it's been growing, and it has grown over the last couple of years. And why I had asked you the question that what exactly is health tech, because while researching, I also got to know that there are these many companies or these many startups which are operating in health sector but are not necessarily into health tech. And hence we can see that we have telemedicine startups, online pharmacy startup, fitness and wellness startup, and so many. And to talk a little bit about the health tech industry, maybe you can also resonate to this if you feel the numbers are right. So it says that India's healthcare market would be by 2025 worth 638 billion. What's your idea on this? What's your thought on this?
Uh, yeah, I was a management consultant for a while, and we did a lot of these predictions.
Mhm.
Um, consultants talk a lot about their predictions for the future. They never go back and look at their
Yes.
predictions in the past for the present day.
Okay.
you know, that tells you something about what these predictions are. But jokes apart, um, look, I think there is only one way this industry can go, which is up. So healthcare in general, I think it's very very limited in India. As as India grows, progresses, GDP increases, there's some natural growth that will come with it. But then also there are lots and lots of entrepreneurs working and bringing healthcare to an ever larger population. So it will obviously go a lot faster than your economic growth would warrant. And then within health tech, I think there's going to be an even faster growth because there is substantial substantial movement in venture capital and interest amongst entrepreneurs to work on problems in healthcare. So I don't know if it reaches that figure or blows that out of water, but it is poised for very, very rapid growth.
Absolutely. All right. So let's go back 7 8 months back. Okay, and when we first heard the outbreak of COVID, and then the entire lockdown thing happened. So how was the approach of myopchars? How was myopchars approach to COVID-19? Like the very first phase of complete lockdown. How you guys dealt with it?
The first the first thing was so there are two responses in that situation. One is internal ops of the company, and external ops, and what can you do for your users,
Right.
right? This is internal ops. The first thing was to ensure that everybody in the company is safe. We get everybody equipped and ready to work from home, and only those who just very necessarily have to be on the field because they're an essential service. So we do deliver medicines as well, right? So those guys, except for them, everybody else was very rapidly set up to work from home. Processes were set, tools were purchased or set up with whatever the case was, and we ensured that that was done. Then as far as users are concerned, the first thing, because the first thing we do is create a lot of credible authoritative medical information. So we got working on creating a lot of legitimate genuine information on COVID.
Mhm.
So in touch with the top doctors in the country, constantly speaking with them, taking their voice to millions of people. uh, if you remember, I mean, now less so, but if you remember back in the day, there was everybody was talking about COVID, and everybody was creating some content or the other on COVID.
Yeah.
And
True.
99% of it wasn't accurate. But you really do have to cut through the clutter, and we were trying to, at least in our own way, provide the absolute most up to date and correct information. So that was the first response. Then of course, even hospitals, doctors, everyone was kind of shut, well, not hospitals but small clinics, etc., were largely shut down. So there was a huge spike in telemedicine, in teleconsultations. So we worked very hard. So there was huge demand, and um, so we worked very hard to rapidly scale up the supply side of it. That was the first thing. Then there were huge disruptions in medical supply across the country. So as far as we could, we tried to scale up our e-pharmacy operations as well, because the demand that came in way surpassed what we were set up to actually fulfill. And I mean, you always have a little bit of extra capacity, based on your demand prediction, but here things just went, way above anything anybody had planned. So that happened as well. So yeah, we tried our best to help as many patients as we could, and
Mhm.
we were rewarded for it. Our traffic increased, our sales increased, and a worry in the health tech industry was that all of this will come crashing down once the lockdowns lifted. That hasn't happened. So we see a huge shift in people's attitudes towards seeking healthcare online, and
Mhm.
I think this has happened in a big part because everyone kind of worked out of the goodness of their heart to help others uh,
Right.
in how they could.
Got it. Interesting. And you mentioned, and you also focused on this thing that 99% of the information that was being circulated was not accurate, right? So that's a follow-up question that I want to ask you, that what exactly you guys were ensuring, or what process you guys had set up so that the information at least going through. There are two parts to this. First of all, you are getting the accurate information. The second thing is the users are actually seeking it as an accurate. They're also not seeing it as just another news that is being uploaded.
Great question. So, look, quality and trust are the two biggest things in healthcare. So, think about seeking healthcare for yourself or your family. You want to be able to trust who you're going to, and you want to ensure that the advice and the medicines, etc., everything that you'll get will be extremely high quality, right? So, the most obvious way is that we have found, and that's worked for us, is to uh, take doctors and make videos with them and get their voice and have them talk directly to
Okay.
users. So we don't get in the middle of it. All we are doing is we go speak with doctors, put a camera in front of them, put a mic in front of them, we let them talk directly to the people. So much as you're recording this and you're going to share it on your various social media channels, we do the same thing. We record these videos, doctor's credentials are given, everything is made absolutely transparent. And when you know that you have the top internal medicine specialist from one of the top hospitals in the country talking to you, then the trust obviously builds up, because who else is going to have more accurate information? In a few cases where we don't have a doctor sitting on the screen, we always source every piece of information that we're using. So we reference everything that we use.
Interesting. And were there any specific trends that you guys saw in terms of the users approaching the content, or in the entire health tech sector? Did you see any particular trend or anything that your team focused on?
Um, I mean, at that point, there was obviously the first level of interest was obviously, what is COVID, what is going on, how does one figure it out, how does one get treated,
Yeah.
one stays safe, what does one do if you get contracted, what are the services available by the government and the private sector. So all those natural questions. The next set of questions were, um, all right, but I don't have COVID, but I do have this chronic condition,
Yeah.
the treatment of which has been hampered due to COVID. What can I do? So that was the next big line of inquiry that happened after COVID. Right? So
Okay.
you're imagine a cancer patient and they're on chemotherapy, but because there's a lockdown now, they can't go to a hospital and get their chemotherapy. So their treatment has been severely interrupted, and that has pretty dire consequences on their health. So, what can we do to help them? That was the next line of inquiry. Then, this was when the lockdown was beginning to open. Then the most common questions was, is it safe to step out? And if I do, what precautions do I need to take? What precautions do I need to take when I come back home, so that even though I have to step out, because look, not everybody has the luxury to work from home, right? Bunch of us have to be out in the field working every day.
Right.
For those people who are out of home and working every day, what precautions do they take? So that was again a big line of inquiry. Then, as COVID kind of spread and it became, uh, you know, more and more people were suffering from it, there were questions around post-COVID care. So I had COVID, I've recovered. What do I need to do now? Because I'm still feeling fatigued, I'm still feeling breathless, I still have a cough, my chest hurts, or there are a lot of other follow
Yeah.
symptoms I've had even after recovering from COVID. So this is all related to COVID, but that's not to say that queries or inquiries about other health conditions had stopped.
Yeah, that is something. Yeah.
Right? So if I mean, if you're a migraine patient, then migraine doesn't suddenly disappear because the word
COVID.
from a pandemic, right? So all of that was still there. So for us, it was so we had to keep doing everything that we were doing, but then on top of it, do all of this additional work.
Makes
And
sense.
everybody was super motivated, worked extra hours, created all of this content very, very rapidly.
Got it. Understood. And all right. So while answering the previous question, you also happened to mention about telehealth. Okay. And I would like to understand, basically, in this digital era where telehealth and virtual consultations are now becoming the trend now, do you think countries will start changing laws to accommodate telehealth instead of physical visits?
Yeah, no, great question. So India has already done that.
Okay.
This thing called telemedicine practice guidelines
Uh-huh.
that released quickly, very soon into the lockdown, because while you've restricted patients from going to doctors, you do need to allow them some way to speak with doctors. So a few things there. So the present government has, even in the past, always hinted that technology will necessarily be needed to solve the healthcare, to fill the healthcare gap in India. That it's just not possible to build the amount of physical infrastructure and to train the number of doctors required in the rapid time that we want to solve, in the short period of time that we want to solve this problem in. Right. So in India's case, given what we had heard from publicly heard from the government of India, this wasn't a big surprise, but at the same time, it was a huge welcome step because, especially because in the past, there had been lots and lots of doubts created, especially by medical associations, associations of doctors who were against digital consultations, teleconsultations.
Mhm.
It was a huge group, also who was very very strong advocate of it, but there was significant opposition, and doctors had always shied away from doing teleconsultations because of those reasons. Um, Now, I haven't followed the regulatory trend in other countries,
Mhm.
but I believe others will follow suit. So the US teleconsultations are picked up, in Europe teleconsultations are picked up. So none of this could have happened if the regulatory environment wasn't clear.
Yeah.
Right? So I expect globally, wherever this isn't already the case, it will be clarified, but in many places it probably already has been.
All right. And it has been proving to be good for the countries that they have implemented this, I believe.
Yeah, of course, right? I mean, even today, if you could just speak to a doctor about a slight niggle you have, you don't need to risk stepping out and going into a clinic or a nursing home or a hospital, right? It makes sense to not expose yourself.
So considering all the factors, and we also understand that having a virtual consultation and what do you say, telehealth or telecalling and all of these things are going to take over the physical thing. But in order to implement all of these, like what sort of strategies can be used when the work we did previously relied heavily on the relationship we built and the face-to-face interaction we had with the people. So now, which is no longer possible, right? So what sort of strategies could you recommend or you guys actually ended up doing?
So Ayush, think of it this way. The 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 thing here is that all of us are in the same boat, right? uh, all of us know that stepping out and doing all the business that you did or all the work that you did in person isn't possible like it was before. And it's the
Mhm.
same for everyone,
Yeah.
right? So whatever relationships you had built uh, with in person activity or in person meetings or interactions, I think for everybody that has translated, I feel reasonably well online. So, a lot of work that we were doing with other partners, we like everybody very, very happily switched to uh, digital meetings or working remotely with each other. So, for instance, like I told you, we were making videos with doctors on
Of
COVID,
course.
going to hospitals. We were, putting ourselves at a little bit of a risk. But over time, you know, our doctor partners adjusted, and they were comfortable getting on a Zoom or a Microsoft Teams or some other digital tool and recording a video like we're doing right now, right?
Mhm.
So typically, uh, doctors are not credited as being super tech friendly, but everybody adopted, right? So I feel like anybody who wants to get something done will find a way. So whether it's in person or remote, I think it just comes down to how badly do you want to get it done.
Got it. Perfect. Now, moving on to a completely different view on this. So we know that, and I also happen to show you the list of the companies that are right now in health sector, if I'm quoting it right, not health tech or tele health or something like that. So first thing first, what do you think, like, who is going to bring about the most change in healthcare? Is it going to be new startups, small startups with new technology, or it's going to be Amazon or Google of the world? What do you think?
Mm, great question. Uh, I mean, it's a fact of life, right? I mean, even even let's just go to like the high tech sector. Is it always going to be, the question that was there 30, 40 years ago? Is IBM going to make all the new innovations in technology, or will a upstart like Apple come along or Microsoft come along and make the biggest changes, right?
Yeah.
So I feel that no matter which industry, no matter what the time, the biggest shifts are always going to come from innovators, and really you'll see those. And I'm not saying this because I'm in startup, but I'm just looking at, historically, every big company was once a startup, right?
Yeah.
Whether or not it was cool to call them a startup when they started up, every company was a startup at some point, right? So big companies have advantages like Amazon's, and so Apple spends is now spending a lot of effort on healthcare. Amazon is getting into e-pharmacies in the US. It'll probably get into e-pharmacy in India.
Mhm.
Um,
Yeah.
Google has a healthcare startup. So these guys are obviously going to make some difference to healthcare given their scale and if they want to focus on this. But I still feel that the sum total of all small startups will probably end up making the most significant dramatic shifts because they can also take those, moonshots and just be like, all right, this is an impossible problem. I'm going to try to solve it anyway. And you'll find once in a while, a couple of brilliant people will come along and come up with an amazing solution that just absolutely
True.
is the world in a meaningful way.
That's why the importance of all of these startups and the ideas that they work on, they become a lot clinical because all of these big companies, according to my understanding, what I understand is that all of the big companies also keep an eye on all of these people. So
Yeah.
I feel that all of these startups might also have an outside edge. And again, adding to what I actually asked you and what the discussion that we have. So basically, now that we know, okay, a lot of startups are coming in, and with so many players emerging in this space, all of a sudden in last couple of years, uh, according to you, how easy or tough is it going to be for a new health tech startup to make a mark in the industry?
Same answer as before, Ayush. There'll always be room for innovators. There'll always be room for creators. So it doesn't matter which industry, doesn't matter what stage. There'll always be some people who will find a way to move the needle forward. If that's just how humans are. If we weren't innovators, we'd still be in the cave, right? So somebody stepped out, somebody discovered fire, somebody discovered the wheel, somebody invented the first tool and reached where we are. So there'll always be people who will be innovating. In fact, I would say somebody who thinks just because so much has already happened, now it's harder to actually create anything new. That same person, 15, 20 years back would have said the same thing then, right? So, and somebody who's a creator will always see opportunity. They'll always imagine what can be, and things can always be made better.
Understood. Valid. It stands valid. Now, talking about healthcare and in a country like India, where the major issue that we are facing for most of the thing is population. Okay, but at the same time, when we talk about health tech, one another angle comes into the picture, which is tech savviness of the Indians. So, what does the future of healthcare look like for a population which are not yet tech savvy? So what do you think about this?
Um, so I think two things will happen. The population that you're saying is not tech savvy. They will get savvier with
Okay.
time. That's just the natural evolution, right? So 20 years back, there's hardly any e-commerce happening in India, right?
True.
Or even 15 years back. There weren't a lot of tech startups coming up, right? We weren't internet availability wasn't that amazing, right?
Right.
Even in Delhi, Bombay, Bangalore, we didn't really get a high speed internet very easily.
Right.
So there is going to be some natural progression where people who are just getting online for the first time in the last couple of years, they'll begin to learn, they'll use it more, they'll get comfortable. So that'll happen. At the same time, um, because India is such a unique country in terms of its user profile, there is a whole bunch of people. So language is an issue, internet speed and connectivity is an issue. Uh,
Right.
Devices, how good they are, that's an issue.
Mhm.
Um, Language is an issue. Income disparity is huge, right? Geographically, we are very, very spread. So there is a very, very different user set, and for them, a good amount of different technologies are going to be built. So Google, for instance, is working on the next billion project, what they call the next billion project, right? So to give you an example, voice interaction is a technology that wasn't needed in the US, right?
Yeah.
everybody who was getting online was educated and they could read. But in India, uh, uh, a voice enabled interface might become a huge driver of growth. So if you can just open your app and talk to it, as opposed to having to tap, click, understand the UI, you could just say, you open the My HR app and you say, मेरी डॉक्टर से बात कराइए, and then a screen pops up and says, आपको क्या problem, and just follow
Okay. Yeah.
from there, right? So these technologies are being built, people are working on them, and they will come out. So there will be technological innovations that will happen, but at the same time people will also get savvy and they'll get more skilled at using making use of the internet, right? So there will be a convergence somewhere. I do expect that the future of technology enabled services and how those services are provided will look fairly different from the rest of the world.
Understood. And just out of curiosity, like if the ongoing trend continues and the pace at which we are growing continues, do you think it is possible in near future, or it's something that okay, another disruption is going to come in and it is going to take the world off their feet?
Yeah, man. So one thing I always say is never bet against technology and its progress,
Wise.
right? Yeah. So
Nice.
um, you know, uh, you might something might be in such a poor state today. You might think this is never going to be what it should be in the next 30 to 40 years, right? But within 3 to 4 years, uh, you'll find that an army of people are working on it, or some amazing person has figured out something which has improved it by leaps and bounds. Like that happens. That's happened over and over, over and over, over and over.
Right. I can. Yeah.
Like, so I would say it'll probably happen sooner rather than later. Definitely in your lifetime, if not mine.
Okay. That was like that's really good. All right, now let's go back again. I've been picking up points from your answers and hence forming the next question. So you talked about innovations, you talked about new ideas, right? Uh, for sure we understand that yes, disruption can happen at any point of time through innovations in any industry, but according to you, uh, currently what is that one area which you feel that is still unexplored, talking from a healthcare standpoint, and is it something that we can see in near future, or what's your thought on this?
Yeah, I think as far as health tech is concerned, very little has been explored. I think it's the opposite.
Oh,
Um,
okay.
we are only just scratching the surface right now. So um, I think the biggest growth that you've seen in health tech is in e-pharmacies.
Mm-hmm.
That's where the maximum amount of investment has also gone.
Yeah.
But now there's a big push behind telemedicine. So that's not just teleconsultation, but it's also telediagnostics, teleradiology, telepathology. So all of those things will happen. Um, and we are very, very far from making them a reality. Telemonitoring is remote monitoring is going to be hugely important. So
Yeah.
in the beginning to see that, right? So you wear your Apple Watch, and if it notices an atrial fibrillation, or it notices something wrong with your heartbeat, it will
Mhm.
send a message to your doctor, right? So that's remote monitoring, right? So can we do that for a huge population which is at risk, right? So our elders, for instance, with time, they a common thing is their bones weaken and they become susceptible to falls, and when they do, they obviously hurt themselves. So today, it's possible to get a fall alert from an Apple Watch, right? So basically, if it's a simple problem. So if your hand is here and it suddenly
Goes.
drops,
Yeah.
quite likely been a. I mean, that's a simple logic, but of course, it goes. It's a little bit deeper than that.
Mhm.
Uh, so can that watch then alert the near and dear ones or a medical team that may a fall has possibly happened? Call the patient, right? So that's a simple example. Can I prick my finger, do a test for my sugar level, and will it alert the doctor who can then immediately send me some advice? And I don't have to necessarily, travel all the way to where the doctor is and get advice, right? So there's a lot that you can do in remote monitoring, and we haven't even like begun to scratch. So If you ask me, we are not even like, we haven't even crossed the 1% level right now.
Oh, okay.
There's
Got
that much left to be done in health tech.
almost everything is left then. I guess we are
Almost
just
everything is left to be done.
and who can we look up to? Any country, any particular organization, or which country is doing like
Still, still, so I wouldn't like, I wouldn't probably, you know, build up to the level of a country because I don't have
okay.
full idea of how much research is going on in every country. So it's hard to do that. But um, whatever be the case, you'll find low cost solutions and versions of it uh,
Mhm.
down to India. So it will happen. Some people will create it, maybe in Israel, maybe in Europe, maybe in the
Yeah.
US. God knows, yeah, who will create it, but somebody will because it needs to
More or
be.
less, we all are on the same boat, I believe. A
Yeah,
little
yeah, I
bit
mean,
here
it'll
and there.
happen. Yeah, I mean, it could happen here as well. Less likely, but let's see.
Got it. And just specifically talking from Indian point of view, like talking about the country, we know that internet penetration is one thing, uh, user acquisition is one thing, then comes the tech savviness of all of these things. So according to you, like what obstacles are there to greater better use of technology in healthcare, like health tech specifically? What all advancement or what all obstacles right now which is there, which is helping out or not helping out the health tech sector?
Great question. So, what are the impediments to the growth of health tech?
Yeah.
Um, the first thing is trust, I think.
Okay.
Uh, any health tech provider needs to spend a lot of time ensuring that they build up enough trust
Mhm.
amongst users or its patients. Right?
Okay.
If you don't trust a health care provider, you will never actually use their services. Right? That's the first thing, and that's something where that's on us, on health tech providers. So in our case, we're dealing with a lot of people who are coming online for the first time. So for them, just trusting uh, the internet to provide, or internet companies to provide any services to them is in itself a big step. And then if you add on the layer of healthcare, then it becomes even more difficult. So we've spent a lot of time trying to build that trust with our users. You have to be very, very patient. You have to stay at it. You have to be very diligent, time after time, every time. You have to ensure that the quality of the service that you provide is of the utmost quality, right? So, uh, like that trust will build up over time. I think
Okay.
that hiatus of that lacuna of trust will is there, but it will build up. A lot of it has gone away with what's happened in the last 6 months, but we still have a bit ways to go. Then, if you talk about mass adoption and not just the few handful of big cities, uh, I honestly feel that just the access to internet itself is not that amazing. It's fairly spotty across the country. Um, it that raises a lot of problems. The quality of service isn't that good for a lot of people. They don't even have access to that service.
Sure.
It makes them harder to trust digital payments. Uh, if you're not even sure that you'll actually get the service, how can you actually make those digital payments? For a lot of our users, they're not actually doing digital payments. So that will also be solved over time. Um, Another problem is healthcare is so vast that it's impossible for one provider to provide all the services, right? And from a user's perspective, um, it's hard to tap to, hard to go to 50 different providers. So that also is a bit of a problem for those who are trying to use it, right? So, like I was saying, so suppose you need to talk to a doctor, you go to one provider. Want a fitness expert, you go to another provider. You want a nutrition coach, you go to another provider. You want to book a lab test, you go to another provider. There are companies trying to aggregate it all, but nobody's been very successful, and maybe because they're not doing it very well, right? So there are several problems that are there, but they're only there now. If we do this conversation in a year from now, many of these will be gone, and
Yeah.
a lot has happened in the coming year.
Definitely, and we hope so that it happens. So yeah, let's see. Thanks for answering this. Now, moving on to another question, and this is something maybe you can talk not as a doctor, Manoj Garg, but maybe from a founder point of view of co-founding this company. Uh, I would like to understand basically what would be the rank, like what are the main motives you could say that that is exciting the venture investor in health tech space? What all are the things? Are there any particular factors which they are investing, or is there any particular other thing that which we are, at least I'm unaware of?
Yeah, no, there's only one thing which attracts investors to any space, which is returns.
Okay.
So, I mean, for financial investors,
Uh,
I mean, that's pretty much all of it, right? I mean, their uh, reason for existence is to give returns on the money that they've raised from their investors, right?
uh,
So right now, it seems like given the amount of distance health tech has to go,
hmm,
uh, anybody who leapfrogs in that race is potentially a prize worth having in your portfolio, right? So I don't think it's anything more than the
returns.
returns.
All right, got it. And like since a lot of players are right now out there in the market, they have been uh, functioning during the COVID, pre-COVID, and post-COVID. A lot of things have changed, and one thing that was there during the COVID that a lot of people lost their jobs, and now health tech or healthcare industry has started getting people on board once again. People are now joining health tech as well, as a fresher or maybe as an experienced folk. So what can be like what would be your recommendations or words for someone who is joining the health tech sector as a marketeer or as a person who is going to join a growth team? What would be your piece of suggestion or advice?
If you've been listening to anything that I've been saying, and growth, you're a growth folk, lot of growth yet to come.
Uh,
So join, uh, enjoy the ride up.
okay, that was crisp.
There's a lot to be done. There's a lot to be done.
Uh,
So anywhere, any can you open up in health tech? There is something to be done. Something amazing to be done. So if you really have that growth mindset, if you're a creator, if you're an innovator, there's lots to be done.
I guess all of these reasons are enough for someone to join the sector, right?
Yeah,
Uh,
we please do join. We want amazing folks
okay,
like you on board.
perfect. So yeah, I'm opening the question answer sessions for the attendees as well. So if you guys have any question, you can shoot in the Q&A tab below. I'll take up the question. Meanwhile, I'll also check if the people who are watching us on Facebook have something for us or not. Just a sec. Okay. Last time okay. So, yeah, Raja Ranjan wants to ask you that he needs to learn about different type of business models in India and world around health tech. Do you have or can you recommend some sources, resources from where he can uh, learn about all of these? Is there
Uh,
anything particular?
yeah, no, I'm thinking. I don't remember like a huge, deeply comprehensive compilation of what all's going on in health tech, right?
Mhm.
Um, I mean, the best thing that I've come across that I mean, the universe is huge, right? First of all, um, so I think if you just Google for some infographics on health tech industry, so the kind that I showed at the start of the conversation,
Yeah.
things will come up that will give you a good sense of how people are thinking about structuring
Mhm.
providers, health tech providers, and who are the big players within that. So if you familiarize yourself with that taxonomy and who are the big names, That'll give you a good sense of what's going on, and then whatever sector you find interesting, you can dig deeper into that within health tech.
And no specific publication as such in terms of like
Um,
mm,
no, I can't recall anyone.
all right.
There are some industry publications,
Mhm.
something that covers India and the world,
Yeah,
and only on health tech. I think that becomes a bit of a niche uh, that nobody's providing for right now.
got it. And probably I'm left with two more questions, and then it would be up from my end. So, in case anyone has any questions, you guys can shoot it in the Q&A tab. So, my second last question to you would be a little bit on a customer from a customer point of view, since a lot of things has changed, and we as a customer, we always feel that okay, we need to get pampered. Like we don't think much about how the other side of the particular thing is working, how they are making sure that the service are being provided. So, in all of these scenario, how can we strengthen the consumer engagement, improve the patient's experience, and optimize where and how healthcare is delivered? Basically, the overall experience that we used to give to the customers, how that can be changed, or how we can efficiently work on that.
Yeah, so as a provider, that's an exercise that we do very often.
Okay.
Is um, go through your own service as a patient
Okay.
and be absolutely critical, ruthlessly critical about how
Service
your experience
now.
is. Right?
Yeah.
So I uh, routinely use our consultation service, our delivery service, just to test what's
Mhm.
going on. Right? I'll call up a friend living in some other part of the country and say, hey, are you looking to order any medicines? Are you looking for a doctor? Use our service. Let me know how it goes. People I know I trust. So there's something that so user testing you need to keep doing repeatedly all the time. You can't ever believe that you've achieved the perfect service level and are maintaining it all the time. It's something that you have to have a razor sharp focus on, and I would say continuously so. So keep going through your service, walk through your service as a patient, see what the experience is. Anything that you found to be wanting, likely somebody else did as well, and it affects their patient experience. Right? So in healthcare, ultimately, it's all about the patient. It's about patient care. So if that care isn't there in the health, then it's hard to really the service level that's needed.
Agree, completely agree. All right. And we have got a question now. It's from Nikhil, and he is asking that what is my Upchar's view on mental health and mental wellness in India? What advice would you give to a startup to grow in this area? And
Uh, oh, wow. Okay, somebody's saying that there seems to be an object in front of me and we didn't notice it. And
no worries. I
yeah,
noticed it, and that's why I knew that we can't do much about it. So yeah,
okay, sorry. I wish you'd said something. I would have adjusted the screen.
no worries. Yeah,
Okay, well, now we're at the end of it, but sorry about this, guys.
yeah.
Um, can you repeat the question, please?
What is my Uchar's view on mental health and mental wellness in India? What advice would you give to a startup to grow in this area?
There is, if there is one therapeutic area which is absolutely mind-boggling in terms of the need and equally mind-boggling in terms of how much has been provided for, it's mental health. I mean, I would probably say that it's there's nothing comes close as close to being ignored as mental health in India. And this is, I mean, things are getting better in the bigger cities, but still way uh, behind where it needs to be. And um, the further that you go away from the bigger cities, the the deeper the problem is. So, in fact, we just started a podcast with um, Fortis Mental Health Department, Mental Health and Behavioral Sciences, It's a podcast dedicated only to mental health. It's that big. So
Yes,
we don't any other programming, any other content creation focused only to one therapeutic area because we're a completely broad-based content platform and therapeutic platform. But mental health is one area which required uh, just content treatment of its own. So if you've got something in your in your gut which says you want to work in this area, there's a lot to be done. Um, but do your research on what you're going to do and how you're going to um, yeah, just like do your research, think through it, talk to people who've done it. Several people have tried with varying degrees of success. One of the bigger problems, so there is a consumer side problem in it, which is that there is a lack of awareness, but
yep.
there is a supplier side problem also that there are just aren't enough therapists in India. So, so what are you going to do? That's where the innovation comes.
Yeah.
So that there is a problem. Now go find a solution.
All right. I guess Nikhil, you got your answer. Uh, in case anyone else has any question, we can take that, but we are running short of time, so I'll just try to. Okay. So yeah. Now we had discussed and we have discussed about how Mayur Char's approach was to COVID. A little quick question because when I was doing the research for this fireside chat, I came across a really sweet gesture that you guys did. That I guess in March itself, you guys announced that any profit that you guys are going to make in this whole pandemic thing, you are going to donate it to PM Care Fund, right?
Yeah.
How did this idea came up, and what was the thought behind this? Like,
Um, so I think I mean, the primary motivation was that we want people to believe that we are there to serve and we're not there to profit from probably the worst pandemic that's hit us as a country and probably the world.
yeah,
We were going to see a huge spike in the demand for our services. We wanted people to know that we were there, risking our own lives and those of our families, for those of us who were still there working every day, like a lot of other frontline workers. But we weren't doing it for a profit, right? But that message is kind of hard to get across. There are
mm,
cynics who will say, look, you're kind of just
marketing.
off
Yeah.
this very bad situation. So we just wanted to avoid any of those questions and just make it very, very clear that none of this is right now is not the time to make a profit. Right now is the time to serve, which was the primary motivation why we started my upchar. And thankfully there was a wonderful avenue that we found where one could actually donate any profits that one would make. So
Got it. All right. And for the last 50 minutes, we have discussed about the pre-COVID phase, the during COVID phase. We also talk about the advancement and all. Now, this is the last question that I'm going to ask you, and maybe you can try to answer it in one word, one sentence, or a detailed thing. So, as a consumer, or maybe you can say as a user, what are the few trends or what are the few advancements I should look up to from health tech industry in 2021? Is there anything that is already brewing up? Is there anything that is already work in progress, or you feel that okay, now this is something that is going to hit hard?
our belief is that telemedicine is going to be the next phase. So um, I think that's something that's always been, that idea that just made an immense amount of sense, but never actually happened. Uh,
Okay.
the great progress in that, and I believe that 2021 is going to be the year where telemedicine becomes, uh, it actually gets, it has its day uh, in the spotlight. So, how nobody thinks about digital payments anymore. It's just commonplace. It's something you and I use on a daily basis. Same thing's going to happen to telemedicine. And from there, then is going to be the really, really interesting times where once people become comfortable using technology as the first step to seek healthcare, right? That's the important part. That becomes the first step in seeking healthcare.
Yeah.
That's when the floodgates will open.
Oh,
So
And when you mention telemedicine, I guess you're talking about the likes of 1mg, NetMed, and Pharmacy, or how? Oh, is there going to be something
Teleconsultation. So people who are providing teleconsultations,
like M Fine, maybe?
yeah, like M-Fine or MyUpchar, or there are a few
Fine.
other
Yeah.
teleconsultations. So I think Practo does it. We do it.
Hmm. Right.
Uh, there are a few others.
Nice. Perfect. All right. So yeah, this brings us to the end of this fireside chat. Thanks a lot, Manoj, for first of all agreeing to do this on a very short notice. I know we have been bugging you a lot for the last few days. So thanks a lot for doing this. It was really great to hear it from you, who is currently building something around health tech and actually doing good. So thanks for doing this.